And then our last clip for chapter 5, we're going to talk about pressure ulcers. These were previously known as bed sores. You can see the staging and the risk factors on page 122 and 123 of your text, as well as the MNT. Immobilization, anybody who's lying in bed and not being turned at any regular time are at greater risk for pressure ulcers. Someone who's malnourished is at greater risk. And it's basically unrelieved pressure that results in damage to underlying tissues. You do have a video in Blackboard that talks about nutrition and pressure ulcers, and it does have some of that staging and some of those pictures. If you have a queasy stomach, just know that there are some pictures of pressure ulcers that go up to the stage 4, which is very severe. The breakdown of the skin is evident enough that you can see bone. So therapies for pressure ulcer, I'm just going to pop ahead to this slide here. I took this picture at Freighter when I was with my students. It's a time to turn, and it's just a reminder for anyone going in the room that this person needs to be turned so that we're not having this unrelieved pressure on the same spot. So someone who, for instance, suffered from a hip fracture and they're lying in bed, they're immobile. They're going to be lying in the same position unless someone turns them. So from lying on their back to lying to their side to lying to the other side, if they're able to get up in the chair. All of these folks with pressure ulcers do need increased calories, increased protein, increased fluid, and then depending on the stage, vitamin or mineral supplements. So really look at page 123 in your text, and there's a chart on there that shows the different stages. It gives a description, and then what the MNT would be for that. And again, you can watch that video if you do choose to. For our developmentally disabled and handicapped clients, our nutrition concerns are feeding problems like difficulty with muscle coordination, maybe polypharmacy, so a lot of drug-nutrient interactions with vitamins and mineral supplements, obesity because of their poor muscle tone and decreased activity, and constipation because of decreased activity in some meds, and then dehydration due to decreased thirst sensation. So someone, when you're working with handicapped clients or developmentally disabled, again, we want to make sure that it's individualized to both the client and then the caregiver, and recognize that the disability may be mental or physical or both, and oftentimes they need the help of a caregiver. So we'll want to make sure that we are including them in our care planning. So some things to think about for chapter 5 is looking at fluid and protein needs for the different diagnoses that we talked about: chronic renal failure with dialysis versus chronic renal failure without, pressure ulcer stage 2 versus pressure ulcer stage 4. Back to our GI diseases, high protein, high calories for things like ulcerative colitis and Crohn's disease. Liver disease, it's going to depend on the staging of that. Again, hepatitis, high protein, advanced liver disease, cirrhosis, that might be low protein if the ammonia levels are high. So I guess I can't stress enough with chapters 5 and chapter 6 that it's going to be individualized based on the client's specific condition. So we don't just give a one-size-fits-all MNT diet order. We're looking at this individual as a whole. So we'll talk more next week in chapter 6.